pain and stress, problems as old as life itself. Throughout history, physicians and researchers alike have sought a means of control for these problems that would be innocuous yet practical. For centuries, they experimented with a variety of remedies, drugs, herbal medicines, acupuncture. Today, many of these ancient remedies are still employed, with limited success. Without doubt, pain and stress are major human concerns. As one of life's paradoxes, they are one of the most common and universal human experiences. Both are phenomena so complex, most attempts to define their total physiologic impact have been woefully inadequate. Pain, considered one of the medical profession's toughest challenges, disables 88 million Americans each year. 50 million Americans suffer temporary or permanent disability, accounting for a loss of 700 million working days each year at a cost of $60 billion. Lost productivity, lost income. When the added impact of stress is considered, the costs are even greater. In its many forms, stress becomes a pervasive force, regularly disabling the nation's workforce. From corporate boardroom to the industrial assembly line, stress knows no barriers. The cost in terms of human suffering and frustration are incalculable. It is in recognition of these facts, 20% of the Fortune 500 companies have instituted some form of stress management program for their employees. Today, in our marvelous age of scientific and technologic advances, millions of Americans are faced with a problem: the inability to obtain relief from pain, stress, and stress-related disorders. Although historically our society has relied on narcotics, surgery, or similar forms of invasive therapy, most physicians have found these solutions serve only as temporary forms of relief. Individuals in pain or under stress have always posed a special challenge to physicians, nurses, therapists, and psychologists. No two individuals react in the same way to stress or the noxious stimulus of pain. In a search for solutions, pain and stress management experts from different medical specialties consolidated their efforts, combining expertise with innovative therapy techniques. The result was a heightened interest in biofeedback. Biofeedback, once viewed with skepticism, has moved from an embryonic research status to a practical adjunct for medicine, surgery, dentistry, and psychotherapy. Biofeedback is a form of training in which individuals receive information about what is physiologically taking place within their bodies. Techniques are required to help control those systems voluntarily. The system operates by providing feedback or information through sophisticated medical instrumentation. Instruments have sensors which pick up the faintest biological signals, amplifying them to provide meaningful information through visual or auditory displays for the patient. Direct access to this information allows the average individual to increase or diminish the level of activity of a monitored function. The patient is connected by sensor wires to the equipment, which senses certain biologic functions: blood pressure, body temperature, tension of facial muscles, even the electrical conductivity of the skin. Information is then fed directly back to the patient. Using self-regulation techniques, patients are able to control stress and stress-related problems. Extensive research studies have shown the efficacy of biofeedback in a wide range of clinical applications. Unlike conditioned responses, an individual working with biofeedback must want a change. Individuals may sign up for stress management or relaxation techniques on their own. However, clients with specific complaints are generally referred by a health professional. Biofeedback offers health professionals a viable alternative for patients suffering physical pain, emotional, or mental disorders. Whether working with a client's physician, psychologist, or therapist, or the individual himself, the staff at the center obtains a complete history of the problem.
When did your headache start? What was the onset?
Oh, it started maybe 4 or 5 days ago.
Then a specific treatment protocol is developed. At the Biofeedback Training and Treatment Center, 3 primary goals are addressed. First, increasing individual awareness of relevant internal physiologic functions or events. Second, assisting the individual in establishing control over those functions. And third, coaching, aiding the individual in learning how to effectively transfer or generalize control from the training site to other areas of their lives. Readily accepted as a treatment modality, biofeedback affords individuals a personal measure of control. Subsequently, most clients are highly motivated and achieve relief quickly. Since the training acquired is neither invasive, destructive, nor addictive, biofeedback can be practiced anywhere, at any time. Utilizing sophisticated state-of-the-art technology, our certified therapists work with the patient, recording their findings. Sensors attached to the body monitor selected physical processes. Information is then fed back by instruments to help speed the learning process. The monitors provide immediate feedback, so the client knows if a desired effect is achieved. Clients are also taught a variety of self-regulation techniques, which enable them to increase their level of physiologic control. As control is demonstrated, emphasis is shifted toward assisting the client to develop an awareness for what they are doing, understanding and responding to their body needs, even when they are not being electronically monitored. Therapists at the Biofeedback Training and Treatment Center quickly teach patients self-control as part of their long-term goals. Certified therapists serve as coaches, guiding, suggesting, and encouraging clients in relaxation techniques, self-regulation, self-awareness, and home practice. Individualized therapy designed for each patient. Frequent communication with the referral agent keeps them appraised of patient progress throughout the training and follow-up sessions, maintaining continuity of care. Specific physiologic goals are targeted at each stage of training. Thus the client, as well as any referral agent, are both able to perceive an individual's progress. The confidence gained by clients usually carries over into other areas of their lives, reducing stress and increasing their ability to handle problems. In short, biofeedback is a mirror, reflecting some aspect of a client's physiology. The client learns to use this mirror to develop control over stress, pain, anxiety, tension, a host of modern problems. At our Biofeedback Center, our task is to help maintain wellness and motivation, assisting clients as they learn to maintain their physiology within a normal range of functioning. Biofeedback is an effective, non-invasive alternative in the management of a wide range of chronic problems. As health professionals gain an understanding of treatment modalities and clinical applications, as they become more familiar with mounting scientific research data and clinical studies documenting efficacy of biofeedback, it will become one of the most frequently prescribed treatments for a host of problems. Dr. Barbara Brown stated, "In the 60s, like a series of underground nuclear explosions, experiments began rumbling throughout the country that presaged perhaps the greatest medical discoveries of all time: the mind as a source of control. Biofeedback, a tool providing an effective means of self-control, preventing the morbidity and mortality of degenerative diseases associated with our fast-paced, industrialized society. Biofeedback, a future-oriented tool to support modern medical, dental, and psychotherapy. The Biofeedback Training and Treatment Center, unique in its concept, employing specialists in biofeedback as an adjunct to existing medical treatment, helping to meet the rapidly expanding needs and pressures of modern society.